So let me just start about the model we have for sustainable operational research. And I think we need to start with some understanding of what operational research is all about. Ronnie Zachariah summed it up once as the science of doing better. And I think that's what it's about, all right? We have a definition here, which is the search for knowledge on strategies, interventions, tools, which can improve program performance and healthcare delivery. We're looking essentially at trying to fix health systems to ensure that those health systems deliver better diagnoses, better care, better prevention to people in low and middle income countries. In the TB world, we have a fantastic system of quarterly recording and reporting of TB cases and TB treatment outcomes. It's a wonderful data set collected routinely by the health service. Many programs are data-rich, information poor. They have a lot of data, but not a lot of it gets used, all right? And we're trying in operational research to say, listen, there's a gold mine out there. If you've got problems, you've got challenges, you should use that gold mine of data to try and solve your problems. And finally, we firmly believe in that the people we train should become trainers themselves. And you'll hear a little bit about this from Srinath. Srinath was one of our first trainees. He's now an operational research fellow. He's running courses now in India.
So once this operational research was published, then a lot of academic criticism that the program was facing to a large extent subsided. And it's not just that the criticism subsided, there was also certain additional information that was generated which showed the lacuna or the areas where the program was performing well and where the program was not performing well. So this really brought about a big change in the way program managers started thinking about operations research and the power of operations research, not only to convince others but as well, but also to take corrective actions as and when it is required.
So a prescription for chloroquine is given to a patient who complains that he's taken this several times before and it just doesn't work. And he asks for an alternative. The doctor says, well, chloroquine is all that is available and it is what is recommended, so I can't do anything else. When research was actually recommended at the time to assess the situation, the response of our clinicians were, we are very busy and we have no time for research. But research was eventually done in that setting, and it proved that the patient was actually correct.
If the person gets their article published, that means it's gone through the peer review process and other people have looked at it and said that this data is credible. And that credibility then can be used for advocacy, for changing programs.
You know, I have the luxury to go into the States to a good college. And as soon as I got in, my professor said, you're going to go 3 months to do a research method course, and I benefit of that. And then I publish a lot. But that was costly, very costly. And many people in my region and in other regions like you're showing don't have access to the colleges in the States because, you know, they don't have access to scholarship or money, parents don't have it. My parents didn't have those, so I have to compete for a scholarship, and I was one of the luckiest ones. But many people are behind. So congratulations, because this is excellent and this is what we need.